Hey everybody, welcome to my channel. If you're new here, thank you for stopping by. If you're coming again, I'm happy to see you. Thanks for coming back. And today I thought I could talk about, sometimes whenever I have had difficulties navigating family dynamics in home hospice. And I made some notes because I will say this, there have been times when you take somebody onto hospice services and the family is not where the patient is at. And that can complicate things in your care plan because the family is an important piece of the care plan for the patient. So there are times when a patient is fully aware that their end of life is near and they are fully on board with comfort care, but the family is not necessarily there yet. And it doesn't matter if the person is 25, 50, 80 or 100. Sometimes the family just isn't there that. Now, when you think of someone who's younger, I can totally relate to that because I don't know if, say, it was my sister, if I would be there emotionally, despite the fact that I'm a hospice nurse and I understand the process of death and dying and the advantage of having hospice in those situations. I still don't know that I would be there in a personal situation, So one of the things is, how do you handle a situation where the patient is ready to stop treatment and the family isn't? So a good thing to do is involve your social worker and potentially your chaplain in a hospice setting, because I'll tell you, sometimes I do not have the same words that the social worker uses, and our social workers are amazing. Every social worker that I have encountered in this setting has just been awesome with wording things that I couldn't particularly say. Sometimes as nurses, we want to say, hey, stop it. Let your mom go. Let your dad go. He's ready. Quit being selfish. But we cannot say those things to families, right? That's not fair because they are dealing with the death and dying process. And as we all know, there are stages that come. We want to bargain. We want to buy time. We want to, talk to God about it. We want to be angry now because why is this happening? We're never ready when we get to that point. And even I, as a nurse, before I was ever on hospice, I was a nurse when my grandma had cancer. And, my grandma was a nurse. So I wasn't ready for her to die. Her children weren't ready for her to die. None of us were ready for her to die, but she was ill and she was ready. She was in that place where she knew it was coming. She had made peace with those things. I'm fairly certain she had made peace with those things because she began asking those questions. And I think it took a lot for all of us to get on board, but we finally did. And I think she had a comfortable death. But I think there was some involvement of outside forces that helped with that. And I think hospice was really helpful in my family's situation. My mother was very close to her mom, and so it is not easy when you flip the sides. I'm a hospice nurse and I deal with people who are in these situations on a regular basis, but I'm also a person who has family and I feel the same way that the families feel sometimes. So one of the things that you can say is, hey, let's have a meeting together and let's talk about these goals of care. Let's talk about what everybody's feeling and involve the patient. If they're at a place where they're able to talk, it is important to give them that ability to say what they feel and what they want. And I have had these conversations because families are angry that you are giving up, that you don't want to continue fighting, that if you just did A, B, and C, you would be doing better. But honestly, sometimes the doctors have said, even if you do A, B, and C, you're not necessarily going to get better. And so patients have weighed those options in their mind and said, well, A, B, and C are really making me tired and I can't enjoy time with my family at this time. And I would really rather not be doing A, B, and C. And I would really rather be spending those days with my grandchildren, watching them play, or going to the movies with my children, or whatever it is. They would rather be doing that thing that makes them happy and gives them joy in the end of their life than be going through those medical treatments that are stealing that joy from them. Because sometimes those medical treatments have side effects which make the patient experience pain nausea, vomiting, exhaustion, weight loss. I use it as an example because I've been on that side, but my grandmother, she was going through chemotherapy and she was already a tiny little woman, and the chemo was making her bones brittle, and she was already so thin, and it made her so much more frail. And the doctor had told her that the chemo was not curing her cancer, so when she fell and broke her hip, I think she decided, and the family decided together, that the chemo was not adding benefit to her life. And I think that that's where a lot of patients get to when they're experiencing medical treatments that are causing more symptoms than relief from symptoms. Because sometimes those treatments are not only doing things to the bad stuff in our body, they're also harming the good stuff in our body, and sometimes that's the side effect. So, the things that you can say is your father has been clear about what he wants, what his wishes are. Your mother has said that she does not want to continue treatment anymore. And that doesn't mean that you're giving up. It means that we're looking at quantity of life versus quality of life, right? Am I going to live longer? And if I do, how am I going to be living my life during those longer moments? Because do I want to spend my time in a hospital bed medicated, or do I want to spend as much time with my family as possible? Hospice doesn't close the door on love, and it actually does open the door for more meaningful moments, because when you know that time is drawing near, you tend to begin to reflect on things. It's a time for healing sometimes, emotionally. Sometimes it brings a lot of pain to the surface. Not all family dynamics are great. Not all relationships are great in families. You're not always close to the person that's dying, but it does bring you to that. It brings you to that reality, and it opens the door to those conversations. And then another question is, what language or approach helps you de-escalate conflict between family members at the bedside? One of the times that I was doing a GIP, it was I will never forget it. And I hope my family watches this and hears me when I say this. Whatever is going on between you and your family should not come to the deathbed. You should not bring your arguments and fighting to the deathbed. I have seen family members yelling and screaming as their parent was taking their last breath. And I pray and hope that my family never does anything like that to me. I want my death to be peaceful and quiet with beautiful music. I had a patient who said that her ideal death was being beside her husband of so many years and listening to beautiful music. And that's what I want. I want to listen to beautiful music and go peacefully. So, the tension does get really heavy in the room, that you can feel it, and the patient feels it too. Even though they are dying, they are feeling that tension and hearing that argument. And I think that would be, it's not a very good way to honor your loved one by yelling and screaming over their deathbed. This is a situation where I would probably call the social worker in, because in this particular situation, God loved the nurse in the situation that I was in. She was able to de-escalate that, and I was able to bring the other family member out into the hallway and acknowledge what they were feeling. They wanted to be acknowledged that this is my mom and I'm losing my mom. They wanted to be acknowledged that what they were feeling was valid, because your feelings are valid in those moments, but you also have to think of the feelings of the other people around you and think about how the person who's dying is feeling. And I think this is great. It's clear that you love her very much, and sometimes love comes out as worry or frustration. Something that I think of often is that when our family members, when they are beginning to decline and go into those last phases of life, anger and panic is very common from family members. I can't tell you how many times I've been yelled at. And it's hard. It's hard when somebody is screaming in your face to think about it from their perspective. But I am never meeting people when they're at the best moment of their life, right? They are losing someone that they're loving. And all of this anger toward me is because they love that person that's in the bed dying. And so it's very important that we remember that they're losing their loved ones, So again, when you acknowledge and validate those feelings and you try to bring it back to a place of love, Sometimes it can de-escalate the situation. Sometimes it is really helpful to get other people involved. Sometimes some people just have a gift. They have a gift for it. I have a social worker that just has a gift for saying things in very meaningful ways that I could not phrase them. And I appreciate her so much. And this is something that I was talking about, is how do you support family that has had a long history of strained relationships? That goes back to not all families get along with one another. Not all families have great relationships. Encouraging them to make peace with the situation as best as possible and acknowledging their feelings. It's always important to acknowledge the feelings of the family members, because you can't always fix whatever happened in their life. I come in and I take care of people and I love my patient, but I don't know what they did to their children in their youth. I don't know what kind of things they might have done to their wife or their husband or their children or their family, or how they treated them. All I am seeing is who they are in this moment and the relationship that they have with me as their nurse. And so it's really hard sometimes, even as a nurse, to acknowledge that maybe that person wasn't a great person when they were young. But it's not my business what they did when they were young. But it is important for families. It is important for families to be able to have that closure if they can. And sometimes you just can't have that closure. Sometimes whatever happened between you and that family member just can't be resolved at this stage of life. But sometimes you can just be there and be present for them, because they're grieving even though they're angry. And then one of the things that comes up a lot is cultural beliefs. Sometimes different cultures and different religions have different beliefs about death and hospice. And even though a patient may be at a place where they want hospice and they agree with it, it may go completely against what their cultural beliefs are. And in some families, the man makes the decision, the husband makes all the decisions, and the wife can't. And in some cultures, doing hospice is just like, they see it like we're killing them, which I have been a strong advocate for this, and I'm going to say this again: hospice does not kill people. We simply allow people to have the most comfortable death as possible. We let them allow their disease process to occur naturally. That's what hospice does. The disease is doing the killing. I promise you, it's not hospice. But in some cultures, you're not going to convince people of that. They don't agree with hospice. They don't agree with what hospice stands for. And they're not going to agree with the family members who are okay with it, or the patient that might be okay with it. And in this case, it is important to involve your social workers and your chaplains who have a better knowledge of those things. It is important as a nurse to be culturally aware. And especially if you have a patient from a certain religious background or culture, it's really important to understand the dynamics of how those beliefs may affect that patient and their death and dying. Families come in all shapes and sizes too. Sometimes a family isn't blood. Sometimes a family are chosen people that we have taken in from our community, that we have claimed as our family through love, not through blood. And so those people are just as important. And I think there have been times when I've seen where a patient had their chosen family and their blood family came in and hadn't been involved, and that really hurt the friends and the chosen family that they had made, the bonds that they had with those people, because sometimes those people were the people that had been there throughout those treatments and the illness, and the family hadn't really been aware of it. But again, you have to honor that family dynamic, and you have to handle it with dignity, because every type of family is important, and the patient's idea of who is important to them should be important in your care too. It's not for us to judge. It's for us to give good care and respect that patient's wishes. It is not our place to come in at the end of someone's life and judge what they did in their prior years, because we weren't there and we didn't know, and we weren't part of that dynamic. But we are here now, and we know this patient now. And so it's important to respect families, respect their dynamics, and involve the right people. Always involve the right people, because I can tell you, I could not do this job without the support of my team, without the entire support of my team. Some people just have a gift for it. Sometimes your CNAs are very well loved by the families, and sometimes those CNAs can say the most profound healing things to those family members. And I have seen my CNAs love on them patients and give them what I could never give, because they have been there spending time with them in the nitty-gritty. So your team, use it. Involve yourself in it and become familiar with who does what, and know who's good at what. Recognize the strengths and the weaknesses in your team, and don't be afraid to say, hey, I have no idea how to say this. I have no idea what to do in this situation. Can you help me? I think I have done that many times in my career, because some things are just beyond my ability to communicate. Sometimes people have had experience with similar situations and they have learned from that. And I think that's just part of being a nurse. So what are some times that you have experienced difficult families, and how did you handle that? I'd love to hear about it in the comments. If you like what you see here, I would love it if you like, follow, and subscribe. And I will answer you back if you ask me a question. So I thank you for watching, and I hope to see you soon.